including Outstanding Veterinarian Award, Guru Ratna Award and Fellow of Animal Nutrition Association. So welcome, sir.
Thank you. Thank you, sir. Good morning. Okay, respected Chairman, Co-Chairman, Rapporteur, and delegates here. So I feel quite hard being here among the livestock, nutrition and the aqua. So how does the pet nutrition fit in? But I tried my best to make sure that I do some justice. So the title has been the clinical nutrition for pet diseases. But unfortunately, I'm not able to cover everything in 20 minutes. So what I thought is I'll probably take a couple of diseases which are quite relevant, very more practical, and that's what we practice in the clinics. So as you probably know that the pet nutrition, pet food is becoming a very big business in India. Currently it's been estimated to be approximately 9,000 crores. Okay, so with this, many players are coming to Indian market, and so there is a influx of a lot of information in the internet, digital media, and we have so-called self-proclaimed nutritionists all over the Bengaluru. I see in my clinic a lot of people so consulting so-called pet nutritionists recommending a diet based on their experience, and it's disheartening to see that these things happening similar to the human nutrition. If you just type in obesity for human, probably you get millions of recommendations. So same thing is happening with the pet nutrition. Probably it's a high time that we have to have some regulation. So interestingly, so I started my journey with developing a standard for pet nutrition in India way back with VIS. Now I think it just last week we almost amended, we upgraded, and hopefully it will be published very soon. And it's important that we have some regulation in our country to make sure that the science is respected and get rid of the quacks that's particularly in the metro cities. So with that introduction, let me go into that straight away. So I've taken a couple of diseases, basically the kidney disease and the cardiac disease, where we recommend a specialized diet. Pet nutrition is a very complex subject. A lot of research has been done. So in fact, most of the information comes from my place where I worked for almost 2 decades at the Walton in the UK. So where we have a lot of information and plenty of brands in the market. And also we have a site called balanceit.com, where it is a board certified nutritionist, and any veterinarian nowadays in Indian vets can also have access, and it gives the recipe for different diseases, right from maintenance to the growth, everything. It's called balanceit.com, so run by the board certified nutritionist. So let's go into that straight away into the CKD. So CKD is probably the most common disease, probably the probably top 3, one of the killers for the dogs and cats. Such a common disease. It's not just confined to senior dogs and cats. We have been seeing in the junior dogs in as long as 6 months or 7 months of cats in the management. But nowadays, the diet has made a big shift in that these pets can live up to 2 years, in fact more than 2 years. We have a lot of dogs in my own clinic where we have been seeing dogs that have been living for up to 3 years with a 1-day dietary management. So that's where I want to take into that. And I'm the person who believes in evidence-based science. So it is very important that we always understand the level of evidence, whether it is really come from the placebo-controlled double-blind studies, where we have a consistent results and where it can be really put into the practice. Talking about the chronic disease, I do not expect you to read everything. What I want to talk about only the nutrition. Obviously, the dog becomes sick, they do not eat, they have a malnutrition. And the important thing, the one is called CKD-MBD, which is the mineral bone disorder. That's where it will upset the phosphorus homeostasis. That's the biggest risk for the development of CKD. And that's where the sequelae of that was increase in the PTH, increase in the fibroblast growth factor, decrease in the calcitriol, and that completely upset the phosphorus, the metabolism. And that's the one which can cause the progression of the kidney disease. The CKD, or chronic disease, kidney disease in dogs and cats, by definition, it is a progressive, irreversible disease. All I can do with the diet approach is to prevent the progression so that dogs and cats live happily. I can prolong their life and improve their quality of life. So that's exactly what we do for the CKD. So this is where I'm trying to focus on the hypercatabolism and the malnutrition. I will not talk much about the malnutrition. So if you see in one slide, if I put it, what happens in a dog and a cat with a chronic kidney disease. So there are some which increases, like the creatinine STMA, that's a clinical parameter. But with respect to the nutrition, fibroblast growth factor 23 is a powerful marker for phosphorus homeostasis. So I did see that it also as good as in the livestock, particularly the Donner-Cough syndrome or the milk cow, where it can be important marker. Now we have kits available for measuring this FGF23 coming from osteoclast and the osteoblast, which can be early marker to say that something going wrong with the phosphorus. Even if you, before you measure the phosphorus ionized or non-ionized, so this can be a powerful marker that may be applicable to the livestock as well. So then in addition to that, we also have a decrease in the vitamin D and alpha chlorothrone. That's an enzyme which is important for FGF23. So what we see, if I put it in a one slide, the management of kidney disease, on the one side I'm seeing which is supported by clinical evidence, and at the bottom is a little clinical evidence. And if you see that in the top or in this side, you can see that all your fluid treatment, antacids, correcting the anemia, there is no such evidence that just giving medicines, fluids, etc. can prolong the life or prevent the progression. However, look at the top. You can see the diet comes on the top there along with the parathyroid hormone, which is interrelated. So diet alone can make a big difference to the CKD patients in prolonging the life and also improving the quality of life. So what kind of evidence we have? So let's look into very, very quickly how it is done. So this is where I want to really focus on. In addition to that, of late, all this is coming up, omega-3, antioxidants, alternative prebiotics, etc. They will not go into the detail. So probably the first eye-opener with respect to phosphorus came in about just 6-7 years ago. If you see NRC or the AFCO, etc., they have a phosphorus limit of a minimum 0.4% of the dry matter basis. And for the both dogs and cats, now the PDF has given a 0.67 and there is no upper limit. That means all is assumed that phosphorus is fine, the dogs and cats can handle it. But however, in the PDF 2025, they also put the upper limit as about 4 with the absolute claim that it can be very toxic to the cats. So the first paper came in the Germany, where they found that they analyzed the pet food sold in the market. They contain 0.6 to 5.8 per thousand kilocalories. So what did they found? They did an evidence-based study there. So those cats with consuming calcium to the phosphorus more than 1 gram per thousand ended up with the abnormal renal parameters. They ended up with the kidney disease. So this took almost so many decades to understand this. Nobody knows. So Tom, Dick, and Harry started making a pet food, the cat food. They ended up with a renal failure. It's a disaster. So then came another study. Later they found that so what is important in the total phosphorus is the inorganic phosphorus. So you should make sure that it's well controlled, and they recommend up to 1 gram per thousand. It should be good with a ratio of calcium phosphorus ratio up to 1. So this is the minimum recommendation per 1000 kilocalories here, not the dry matter. This is the recommendation. So what it says is that now probably it is a time to put an upper limit for phosphorus in the dogs and cats. It is yet to be published because the NRC is a bit outdated. Last publication came in 2006. So obviously phosphorus is one of the biggest culprit. Probably you have to look into that one. So that's one of the important thing. So what does this phosphorus cause? It not to slow the progression of the disease. It can really limit the nutritional secondary hyperparathyroidism, very, very important. It can reduce the soft tissue mineralization, and most importantly, your job is to control the phosphorus level. So this is very important. Those dogs and cats, for every 1 milligram of phosphorus increase is associated with increase in the mortality. So those had hyperphosphatemia, the mortality is very high, they died early. That's very, very clearly come from many studies. So what happens in a dog with a CKD, when there is a reduced renal function, reduced GFR, increase in the phosphorus retention, and that the first one to work is a FGF23 coming from the osteoclast, and that will stimulate, decrease the calcitriol, cause hypocalcemia, trigger the PTH, then it becomes a vicious cycle, as you can see here. So this is something, if I really look into the FGF23 rather than measuring the PTH of the inorganic phosphorus, probably it gives a clue that something going wrong. It may be early sign of a CKD. So that's where I can really start that one, because most this percentage of put it here, 70 to 80% of the dogs and cats do have a hyperphosphatemia causing nutritional secondary hyperparathyroidism. So this is what I look into that. So there is any association between these two? Yes, it's shown very, very clearly. So if the fibroblast factor, growth factor, if it goes beyond 400, in the absence of anemia or other inflammation, it is indication that there is a phosphorus homeostasis is being deranged and it's a time to intervene. It also shows that, so it also useful as a marker for azotemia. So it's a very important parameter, probably it applies to livestock as well. That's something can be done. So what are the studies are done? There are plenty of studies. I'll put it in one slide. They combine all combination of high phosphorus, low phosphorus with respect to the protein. What they did find, the protein did not really have much influence, whereas the moderate amount of phosphorus definitely had a big influence in stabilizing the kidney function and controlling all the uremic symptoms. So this is very, very clearly, a lot of studies have come from this one and it's shown very, very clearly. So what is the current recommendation? Depending on the staging of chronic kidney disease, we have a different recommendation is come. But for a practical purpose, I try to keep it less than 6.5. As long as I control the phosphorus less than 6.5, definitely I can give assurance to the cat and pet owner with the CKD dog or a cat that it can really live longer. I can give it a very, very with confidence. That's very, very important. And so that's definitely. So just to make a conclusion, take home message. So we have a strong evidence. You want to put it as a moderate based on the last few papers, whereas with the recent paper, there is a strong evidence controlling the phosphorus is shown to prevent the progression of chronic kidney disease, a powerful statement, and improve the survival. So that's the first thing that probably would tackle in case of a dog with CKD. What about protein? So protein, always been told that protein is toxic. Even in the many veterinarians, they believe that protein's restriction is important even in the senior dog. So healthy dogs can handle any amount of protein. Similarly, protein has no upper limit. But the question is, we have been taught that reduce the protein in the liver, reduce the protein in the kidney. But does it have any influence? Does it have any strategy? Where this all this came from? So a lot of studies in the dogs have shown that very, very clearly that there is evidence that just simply controlling the protein will not really cause a progression of the disease. That's very, very important. So, however, with the current studies, there is no such strong recommendation, but they say that if you have to keep the 35 grams per 1,000 calories as a protein, a moderate amount, not too high to cause a uremic symptom. That's the recommendation in the dog. What about cat? In the cat is very clearly, enough studies, it cannot reduce the protein, is very important for the cats. Otherwise, it causes the protein malnutrition. The current recommendation is when the creatinine goes beyond 1.6 or when you have a urine protein creatinine ratio of more than 0.4, we start controlling the proteins. Very, very clear, and there is no argument on that one. So, do you have any studies? This is a few studies published in the peer-reviewed journals. So I've taken all the references. So this is the first study to show that renal diet with the maintenance diet, if you see the time to develop the uremic symptom, vomiting, gastritis, etc. So it took only about 252 days, whereas the dog and the case, it took almost 3 times, 615 days. Definitely renal diet able to control the symptoms. So likewise survival, if you see the medium survival, renal diet versus the maintenance days, you can see almost 3 times. So they can live longer, almost 3 times compared to your maintenance diet. Absolutely, it is recommended there. So regardless of the death, the renal diet can really prevent the mortality and the risk of death by almost 70%. It is a great study to show that one. So lastly, uremic acid in the cat. In the cat, again, the same story. It can reduce the uremic symptom, it can reduce the mortality, and you can see study normal diet versus renal diet. There is a big difference in the survival time. So definitely it is indicated there. So in conclusion, we know that it can slow the progression and delays the onset of uremia, and it is going to improve the kidney function if you use the renal diet. So this is a typical difference between the maintenance and the renal diets, and just 1 minute, sir. Okay, so then lastly, the omega fatty acid is very, very important. All I want to talk is that we know that so all this we have studied, it goes through the cyclooxygenase pathway and the lipoxygenase pathway, and it's an anti-inflammatory. But what is shown recently is These are the so-called the resolvins and the protectants. They are the one important, that is play very important role as a, not just an anti-inflammatory, even getting rid of all the inflammatory products, etc. And also we have shown that it can also influence at the gene. So in the morning someone is talking about gene transcription, omega-3 can cause that insufficient to produce the resolvins and the protectants. So it has a very, very important role in the protection of the kidney in the both the dogs and cats based on the study state. So antioxidant, as skip so it is not required. And lastly, the gut renal has been a talk of the town nowadays. Everything has been linked to the gut brain, gut kidney, gut heart, etc. And so this is what shown. Probably I do not have time for this. I think there's a new area that probably I could. So thank you so much, sir. Thank you. Happy to take.